I see patients every day for injectables and skin treatments. And quite often, I have an honest conversation that surprises people. Sometimes, the best option isn't another syringe. It's a facelift. As an aesthetic doctor, I don't perform facelifts myself, but I do help patients understand when non-surgical treatments are enough and when surgery simply does it better. But first, let me introduce myself. I'm Dr. Detollenaere, an aesthetic doctor from Antwerp, Belgium, and owner of Dr. Contour Clinic. I make videos about aesthetic treatments, skin health, and graceful aging. So if that's something you're interested in, don't forget to subscribe to this channel. Today, I want to walk you through how I make the distinction when a facelift actually makes sense, what to expect before and after, and how to maintain or even delay the results through consistent care and the right non-surgical support. Facelifts are everywhere on social media lately. I recently saw a video of a 28-year-old getting one, which honestly felt a bit extreme. So it's understandable that people are unsure about when a facelift is actually appropriate. For many, the word facelift still sounds dramatic or unnatural. We tend to picture that overpulled look from decades ago, but that's not what modern facelifts are anymore. With today's refined techniques, the goal isn't to change your face, it's to restore balance, to reposition what has unnaturally descended, while keeping your own features intact. You should look like you. Just a more refreshed version, like you've had the best rest of your life. Not a new identity. Over time, more facial structure changes, skin loses elasticity, volume shifts downward, and bone support gradually diminishes. For many years, non-surgical options like injectables, collagen stimulators, and energy-based tightening treatments can help maintain that harmony. But eventually, the deeper tissues, the ligaments and muscles, start to descend in a way that non-surgical treatments can no longer correct. And that's when a facelift becomes an option worth considering. But it should always come from a place of self-awareness, not pressure or comparison. Ask yourself, why am I doing this? Do I want to look like a completely different person? Or simply like myself, but more rested and confident? Because true rejuvenation doesn't erase who you are, it enhances the version of you that already exists. So once you've thought about why you'd consider a facelift, the next question is usually, when? And this is where most confusion starts, because there isn't a magic age that fits everyone. Now, before we talk about timing, when a facelift might actually make sense, it's important to understand why these changes happen in the first place. Because aging doesn't just happen at the surface, it's a process that affects every layer of the face. The 5 pillars of aging. When we talk about facial aging, we're really talking about several processes happening at the same time, not just wrinkles or sagging. There are 5 main pillars of aging. 1. Fine lines and wrinkles caused by repeated muscle movement like frowning or squinting. 2. Volume loss in the fat pads, connective tissue, and even the bone. 3. Changes in skin tone and pigmentation. And 4. Loss of elasticity and texture as collagen and elastin break down. And 5. Bone resorption, the gradual shrinking of the facial skeleton. Together, these lead to what we visually recognize as sagging, the descent of the facial structures over time. A facelift mainly addresses that structural descent. It lifts and repositions deeper layers, but doesn't correct muscle-related wrinkles like crow's feet or frown lines. Those are treated with neuromodulators like Botox. And it doesn't restore lost volume. That's where fillers or biostimulators such as Sculptra come in. So, while a facelift can redefine the jawline and reposition what has fallen, it works best as part of a combined, layered approach that also maintains skin health and volume balance. Now that you understand how the face really changes with time, the next question is usually the same one my patients ask me. Okay, but when do I actually need a facelift? When is the right moment? Well, there isn't a perfect age for a facelift. There's only the right time for your face. If it's done too early, when there's minimal sagging, the results can look unnatural and often require revision sooner. If it's done too late, when the tissues and bone have already lost significant support, the outcome can appear overly tight or dramatically different. So the best results usually happen when you still have good skin elasticity and bone structure, but visible sagging is starting to bother you. For many, that's somewhere between their late 40s and mid-60s, depending on genetics, lifestyle, and sun exposure. And just as important as when is who. Choose a surgeon who not only sees your face today, but envisions how it will age in the future. A responsible professional will sometimes say no, and that's exactly the kind of honesty you want. What a facelift really does and doesn't do. So, once the timing feels right, the next question is often, what does a facelift actually do? Because a lot of people still think it's just about pulling the skin. And in reality, a facelift goes much deeper. It repositions the structural layer under the skin, what we call the SMES, which supports the cheeks and jawline. And by lifting these tissues and removing excess skin that no longer has elasticity, it restores definition along the jawline, the neck, and the mid-face. But it's equally important to understand what a facelift doesn't do. It doesn't improve your skin quality. So if the skin is dull, sun damaged, or dehydrated before surgery, it will still need ongoing care afterwards. Think of it this way: surgery restores the architecture. Skincare maintains the surface. You still need your sunscreen, your antioxidants, and your collagen support every single day. Because a facelift isn't a replacement for good habits. It's simply a reset point that gives you a fresh foundation to build on. And that brings me to something I emphasize with all my patients. The surgery itself is only part of the story. What truly determines how long you love your results is what you do afterwards. Maintenance. The true key to longevity. Maintenance is where long-term beauty truly lives. It starts with consistent skincare and sun protection, ideally even before surgery. In the months after a facelift, your focus should be on healing and rebuilding the skin barrier. Avoid harsh actives or aggressive treatments until the skin has fully recovered. Once healed, small but regular touch points make the biggest difference. Neuromodulators to prevent downward muscle pull, PRP or collagen stimulators to maintain skin structure, microneedling for texture and tone. And later, gentle radiofrequency or ultrasound tightening to preserve firmness. The goal isn't to do more, it's to do what's right at the right time with consistency. And this is really where non-surgical care shines. It's what keeps results looking fresh and natural over time. Now, not everyone needs or wants a full facelift. Sometimes aging starts in smaller, more delicate areas. And addressing those early can already make a world of difference. Starting small, the eyes often come first. For many people, the first area that truly shows fatigue or aging is the eye region. The skin here is extremely thin and expressive, which means it's also the first to lose its freshness. When the eyelids start to feel heavy or rest on the lashes, or when puffiness becomes constant, a subtle eyelid lift can make a remarkable difference. It doesn't change your identity, it simply restores openness and light to your gaze. And if you're not ready for surgery, there are beautiful non-surgical options that help strengthen this delicate area. Polynucleotides, PRP, biostimulators, or even light peels or radiofrequency microneedling to refine the texture. These can delay the need for surgery while keeping the eye area bright and youthful. And of course, beyond the physical results, there's another side that deserves equal attention. The emotional experience that comes with seeing a refreshed version of yourself. The emotional side of surgery. It's something people don't talk about enough. Even when the outcome is beautiful, it can take a little time to adjust to your reflection. Some patients feel instantly relieved and confident, and others need a few weeks before they fully recognize themselves again, and that's completely normal. The most fulfilling results happen when you're emotionally ready, when you're doing it for yourself, not out of panic, comparison, or external pressure, because physical rejuvenation without emotional readiness rarely brings true satisfaction, even when the technical result is perfect. And that really leads to the bigger picture, how we think about aging as a whole. Because at the heart of all of this, whether surgical or not, lies a philosophy: aging gracefully. The Dr. Contour philosophy. At the end of the day, aging beautifully isn't about holding on to youth. It's about embracing your evolution. It's the art of maintaining balance, caring for your skin, respecting your natural features, and making thoughtful choices that honor your individuality. Whether you choose surgery or stay completely non-surgical, there is no right or there is no wrong. The goal is always the same: to feel confident, radiant, and authentic in your own skin. Because beauty isn't about perfection, it's about presence. Thank you so much for watching. If you'd like to learn more about non-surgical ways to maintain your results or support your skin, you can find more information on the Dr. Contour website. And as always, wear your sunscreen, stay consistent, and honor the face that tells your story.